Good afternoon, guys. Welcome back to my channel. As you know, this is part three treatment of heart attack. So, if you've been following me with the part one, part two for the treatment of heart attack, this is part three. So, this is Dr. P. So, don't forget to subscribe to this channel for you to get more video. So, now we're going to start part three, the treatment of heart attack. So, in part three, we're going to discuss the type of medications that are used to take care of heart attack. So there are various medications that are used for the treatment of heart attack. So the first one we're going to talk about is anticoagulants. Examples of anticoagulants are the heparin, warfarin, such as Coumadin. So these are used to treat certain blood vessels. They used to treat heart, and they also used to treat certain conditions of the lung. So then we also use antiplatelets, antiplatelet drugs. Example of antiplatelets are aspirin, Plavix. So they keep blood from clotting. So by preventing blood platelets from sticking together. Then we also use the ACE inhibitors. You all know ACE inhibitors is known as the angiotensin converting enzymes. So how do they work? They expand the blood vessels. They decrease the resistance by lowering the levels of angiotensin 2. So they allow the blood to flow more easily and make the heart work easier and more efficient. So examples of ACE inhibitors, those are the pre group, the lisinopril, the benazepril, the captopril, the enalapril, the ramipril. Then they also use the next one, we also use the angiotensin 2 receptor blocker. So this one is called angiotensin 2 receptor blocker. So instead of lowering the levels of angiotensin 2, they block it. So they block the angiotensin 2. So this prevents this chemical from having any effect on the heart and blood vessels. So this keeps the blood pressure from rising. So what are the examples of angiotensin receptor blockers? Those are the losartan. That's why sometimes when they don't give them the ACE inhibitors, they give them losartan. So losartans, you have the cardisartan, or everything with that end with TAN. So then we also have the angiotensin receptor neprilysin inhibitors. They inhibit a chemical which is known as neprilysin. So neprilysin is an enzyme that breaks down the natural substance in the body that open up narrow arteries. So when you inhibit this enzyme neprilysin, those natural substances can have their normal effect. So they improve the arteries, openings, and blood flow. They reduce the level of sodium, that's the retention of salt, then decrease the strain on the heart. The next one, which you all know, the popular one, is known as beta blockers. So the function of the beta blocker is to decrease the heart rate. That's when you give a beta blocker, you have to monitor the heart rate of the patients because it can decrease it below 60 heart rate, 60, yeah, below 60. So they decrease the heart rate and they decrease the cardiac output. So this helps to lower the blood pressures and make the heart work more slowly with less force. So they decrease the force of contraction. What are examples of beta blocker? We have a lot. You have propranolol, you have metoprolol, you have nadolol, you have atenolol, you have acetbutalol. Then you also have the one which is known as the combination of alpha and beta blockers. Because we have alpha blockers, we have beta blockers. So when they are combined together, so these are used, they can be used for IV drips and they can be used as an outpatient prescription. So they are used as an IV drip when the patients are experiencing hypertensive crisis. That's hypertensive crisis when the blood pressure is highly elevated above 200. So examples of combined alpha and beta blockers, that's Corec, Carvedilol. You have Labetalol, otherwise known as Nomodin as the trade name. So the trade name for Carvedilol is Corec. Then also we have another one that is also popular, which is known as calcium channel blocker. Calcium channel blocker, examples of calcium channel blockers, those are Novas is very popular, what otherwise known as amlodipine. So we have the Procardia, otherwise known as nifedipine. Then we have the verapamil. So we have the dithiazine, otherwise known as cardizine. So calcium blockers, the name implies they block calcium. So they block the movement of calcium into the cells of the heart and blood vessels. So this decreases the pumping strength of the heart. They relax the blood vessels. So we also have cholesterol lowering agents. We all know how to lower our cholesterol. So people love use of this drug for to lower the cholesterol. So examples of cholesterol, those are the statins. Statins are mostly used, but when patients in a situation whereby patients start experiencing the side effect of statins, they can use other agents of cholesterol lowering agents. You know, examples of statins are Lipitor, which we all know, the atorvastatin. Then we have the pravastatin. We have Cristal. We have simvastatin. These are most popular, otherwise known as Zocop. So we also have Zetimbe. This also to lower your cholesterol. So we all know that sometimes people don't want to take this. People have they complain they don't want to take statins. They believe that the statins have an effect on the liver, but you all know that the benefit outweigh the risk. So but I've never seen they've been no it hasn't been proven, but there's a belief out there. Research is being done, but side effect of statins, you have the muscle ache, muscle pain, you have the joint pain, you have headache, you have nausea. So those are the side effects of statin use. Then the next one people also use, you have diuretic. Diuretic is very popular with patients with heart failure. So diuretics. So we have the two type of diuretics. You have the loop diuretic, which is known as the Lasix. Then you have the potassium sparing diuretic, which is also known as the spironolactone, otherwise known as adactone. Then also thiazide diuretic. Those are the potassium, otherwise known as hydrochlorothiazide. Those are potassium sparing diuretic. So what are the functions of diuretic? They decrease the buildup of fluids in your lungs, in your legs, in your ankle, in different parts of your body. So they help reduce the workload of the heart. Then other drug they can also use for heart treatment is known as vasodilator. So vasodilator they dilate the blood vessels of the heart. So thereby relaxing the blood vessels, they increase the supply of blood and oxygen to the heart while they're reducing the workload of the heart. So they can be available as pills, chewable tablets, or topical applications. Examples of vasodilators are nitroglycerin. Also hydralazine, they are also known as a vasodilator. Then there's a situation where we know as the dual antiplatelet therapy. Those are used for patients that just undergo surgery, heart surgery, such as when you have a stent platelets in your coronary arteries, or you undergo a coronary artery bypass surgery. Those people they need a dual antiplatelet treatment therapy. So that's whereby you see some patients they have to give them aspirin and Plavix. So we call it dual antiplatelet therapy. So thank you very much having listening to this video for the part 3, so you understand the various treatment of heart attack. This is Dr. P. So don't forget to subscribe to this channel and give me a thumb up. I will see you again next time. Bye.